Hello, we want to speak about the importance of glycemic markers other than A1c for managing diabetes mellitus. Hemoglobin A1c has become the standard for monitoring glycemic control and is considered the gold standard for predicting hyperglycemia-associated risks and complications of diabetes. Due to the global reliance on A1c for glycemic monitoring, it is essential to recognize clinical scenarios and interfering factors that can result in vastly elevated or greatly lower A1c values. Our case is a 33 years old female with history of insulin-dependent diabetes mellitus who established care in our endocrinology clinic, and during her initial visit, her A1c was 4.9%. Upon chart review, it was not that her A1c values had consistently been no higher than 6%. She was on insulin therapy at that time, but she also attended before non-insulin therapies. Her diabetes-related complications include retinopathy, lower extremity wounds, and admission for diabetic ketoacidosis. She also had undergone gastric sleeve and bypass surgery, and she had dumping syndrome since then. There was no history of hemoglobinopathies, lipid abnormalities, renal or liver failure, and her self-reported A1c values didn't seem to correlate with the average glucose levels at home. As a result, a fructosamine level was checked and a continuous glucose monitor, a CGM, was installed, and subsequent CGM readings indicate a glucose level in the 300-400 range, with fructosamine levels suggesting an average glucose level of 10%. Once her true glycemic status was confirmed, her insulin regimen was intensified to achieve her desired glucose goal. However, the patient had difficulty tolerating glucose levels in the 100 as she had been accustomed to much higher level for years. As we can see in the report of the CGM, she used to have glucose more than 200. And in the same period of time of this CGM reading, the A1c used to be like 5.2%, 4.9%, 5.1%, with fructosamine levels in 396, 401, and 347. So, while the A1c has traditionally served as the gold standard for diabetes management, it is crucial to understand when it may not be a reliable indicator of glycemic status and the risk for complication. With the introduction of the CGM, there has been a significant improvement in glycemic monitoring, providing a reliable way to track glucose level. Additionally, fructosamine levels and glycomark are valuable alternatives. In our patient's case, the reason for the lack of glycosylation was unknown, but she was aware that the A1c was not a reliable marker. Years of uncontrolled glucose level, despite a seemingly good A1c, had contributed to her complications. Thank you.